What is going on, guys? It's boy coming to you with some live pelvic action. This video was created using anatomy learning software. Please support them by visiting their website, linked in the description box below. Alright, so my goal in this video is to get you familiar with one of the most difficult bones in the body, I think, to three-dimensionally visualize, which is the pelvis. Now, calling it a bone, as in one bone, is actually pretty incorrect. And that's a problem that I had before taking anatomy. I actually thought the pelvis was a single bone and thus part of the axial skeleton, but actually it's part of the appendicular skeleton because it's actually a composite of 6 bones existing in right and left hand pairs. So that is what makes it part of the appendicular skeleton. Now, I mentioned just now that it's actually composed of 3 bones. 6 bones, I said, but rather 3 pairs of bones on the right and on the left hand side. The sort of normal curled bone here is called the ilium. That's the vocabulary word, the ilium. And you can see that here, the ilium. The pink bone, which is posterior, is called the ischium. And the blue bone highlighted here is called the pubis. And all of these bones join together to create the point of articulation with the femur, called the acetabulum. So now, looking here on the complete 3-dimensional view, here we have the pubis, here we have the ischium, and here we have the ilium. And here, where the femur is articulating, we have the acetabulum. Next, I'm going to go over some of the most important landmarks, not all of them, but some of the most important landmarks, and also give you a better idea of what they do and why we bother to learn these landmarks. So there are several landmarks. Each of the blue dots is in fact a landmark. However, I just want to quickly draw your attention to this landmark. This is called the anterior superior iliac spine. The anterior superior iliac spine. This is an important landmark for many muscles, including the sartorius, the tensor fasciae latae, and also the inguinal ligament. Now, inferior or below the anterior superior iliac spine is the anterior inferior iliac spine. So if you keep in mind that superior means above and inferior means below, you can sort of figure out what these names are based upon the fact that this is in fact the ilium where it's located. The ilium, where here is the ischium and here is the pubis. However, we're here at the ilium, and the anterior inferior iliac spine has the same sort of importance, although the anterior superior iliac spine is connected to more things. However, the anterior inferior iliac spine isn't unimportant. It's actually connected to one of the important muscles of your front leg, which is called the rectus femoris. Moving on, we are about to cross over. Now, this arm here is now part of the pubis, the sort of marker as to where the ilium and the pubis connect is around here, where you see this marker here, which they don't have a point for. This is called the iliopubic eminence, and it does have some significance, and there are a few things that are actually attached to the iliopubic eminence. But this point is sort of what separates the ilium from the pubis. After the iliopubic eminence. And going into the pubic region, we see the superior pubic ramus. A ramus is anything that looks like an arm. So you see a ramus here, and you see a ramus here. These are both rami, except one is superior and one is inferior. And the ramus, as well as the rest of the pubis, is important for connection with muscles on the internal portion of your thigh. The internal portion of your thigh. Here, we're looking at the pecten. This line right here is called the pecten of the pubis. The pecten. And this is an important marker for one of those internal thigh muscles. It's called the pectineus. Pecten, pectineus. And so that's why it's important to note that this line right here actually has some significance. It's called the pecten. And below that, we have the pubic tubercle. The pubic tubercle. So if I go back, we look at this and we see the pubic tubercles of the left and right pelvis are right next to each other. So you have the anterior superior iliac spine, the anterior inferior iliac spine, you have the iliopubic eminence, you have the superior ramus, you have the pecten of the pubis, and then you have the pubic tubercle. Next, you go down and you have the inferior ramus. The inferior ramus. This is the superior ramus. This is the inferior ramus. We're going to look here at the ischium. The ischium. And this sort of obnoxious little protrusion here, or big protrusion, is called the ischiotuberosity. The ischiotuberosity. And this is actually also a very important point of attachment for muscles of the thigh, in particular the posterior thigh, the back of your thigh, your hamstrings. Now, proceeding upward, we have a landmark right here called the ischiospine. The ischiospine is also a pretty significant point of attachment. Now, the ischiospine is at the base of this curvature here. This curvature is actually very important, and it is called the greater sciatic notch. By the way, this curvature here is called the lesser sciatic notch, which is honestly not as important as this greater sciatic notch. The greater sciatic notch is actually the site where the sciatic nerve passes through. So the sciatic nerve sort of protrudes through the sacrum and passes back here through the greater sciatic notch and then runs through. Next, we have the posterior inferior iliac spine and then the posterior superior iliac spine. Notice that they're very similarly named to the anterior iliac spine, the anterior superior iliac spine, and the anterior inferior iliac spine. So you sort of know that these top four protrusions here have the same name because they're on the same bone, the ilium. And the ones that are on the top are superior, and the ones that are near the bottom are inferior. Additionally, the ones in the back are posterior and the ones in the front are anterior. I'm going to go back and address this gap right here. I had some trouble remembering the name of this hole in the beginning. It's called the obturator. The obturator foramen. And I had to keep on going back to the book and seeing that it was obturator. It got a lot easier because in later sections you're going to see that this is actually a point of reference for a lot of muscles and nerves and vessels that also share the name obturator. And you can trace that back to the fact that they attach or pass through this obturator foramen. Two more things I want to address before we end this video is the internal and external, or the medial and the lateral sides of the ilium. The medial side is called the iliac fossa. This depression right here, the iliac fossa. And what it is it's a very important site of attachment for a muscle called the iliacus. The iliacus muscle. And on the other side, you have what's called the iliac crest. The iliac crest. And the iliac crest is a very important site of attachment for the gluteal muscles. You might have heard of one of them, the gluteus maximus. Just for a quick review, you have the anterior superior iliac spine, the anterior inferior iliac spine, the iliopubic eminence, the superior ramus, the pecten of the pubis, the pubic tubercle, the inferior ramus, the obturator foramen, the acetabulum, the ischial tuberosity, the ischial spine, the greater sciatic notch and also the lesser sciatic notch, the posterior inferior iliac spine, the posterior superior iliac spine, the iliac crest, and the iliac fossa.